Come gather round, people, wherever you roam, and admit that the waters around you have grown, and accept it that soon you'll be drenched to the bone. If your time to you is worth saving, then you better start swimming or you'll sink like a stone, or the times they are a-changing.
Hello, my name is James Frickton. I'm a professor at the University of Minnesota, and I'm a clinical pain specialist, a pain researcher, and an author. My goal is to stamp out chronic pain, and so I've developed this course on prevention of chronic pain, a human systems approach. Bob Dylan, another Minnesotan, wrote this prophetic song in 1964. The words still apply to our current times, and particularly to healthcare and chronic pain. Chronic pain is at epidemic levels around the world. Nearly 1 of every 2 people has chronic pain of some type. It interferes with our lives, makes us unhappy, and can lead to depression, even suicide. And despite dramatic advances in surgeries, pharmaceuticals, devices, and other treatments for pain, it still is the highest cost condition in all of healthcare. More money is spent on chronic pain than cancer, diabetes, and heart disease combined. Acute pain is clear. If we get a splinter in our finger, for example, the pain tells us right away where we've been punctured and motivates us to pull it out before it causes more problems. But what's the message when the pain becomes chronic? Here the message lies in the risk and protective factors in every realm of our lives that can cause chronic pain. Changing these factors using a systems approach is the key to preventing chronic pain. Allow me to start with an analogy. Think of our lives as a wine glass thrown into the air. There are a lot of risks that can lead to the glass breaking, and by extension, pain. Whether it breaks or not depends on a lot of little things. How heavy it is, how hard it gets thrown, how high it's tossed, what angle it flies at, and whether it's spinning, whether it's caught, and if not, what surface it lands on. There are lots of risks and protective factors that determine whether it breaks or not. Likewise, we don't know what life will toss at us. There are lots of many little things we can do every day to reduce the risk of shattering into chronic pain. It's also about what we do with our glass. Now, is our glass half empty or is it half full? In this course, we will help you understand the most common conditions that can cause chronic pain, their impact on our lives, and the mechanisms behind them. And don't settle for a glass half full. We want you to fill your glass by learning about the little things that you can do to prevent chronic pain. We'll provide you with a virtual toolbox of self-care strategies in each realm of your life to prevent chronic pain. I wrote this novel. It's a romantic thriller self-help book, and it's all about preventing chronic pain. As an introduction to each module, we'll use the story to illustrate the concepts. So the course will be interesting. And we want the course to be similar to a quote by Gandhi. Be the change you want to see in the world. That's what this course is all about. So please register for the course and engage in the conversation. Divine is the task to relieve pain. Thank you.